So just a few notes before we get started today. We are recording this Zoom meeting, and we will share the recording after for those who couldn't make it today. For the presentation portions of today, make sure you mute yourself, but chat is enabled the whole time, and we will be pausing for questions and comments during a couple sections of today's webinar. We will have closed captioning available for the meeting. So to enable this function, select live transcript or closed captioning on your Zoom toolbar. And then during the comment section, if you're dialing in, dial *9 to request to be unmuted, and then *6 to unmute yourself to speak, and then dial *6 again to mute yourself. And then today, if you have any technical issues with Zoom, please email adrc@aging.ca.gov. And someone is actually, our team member Janice is monitoring that box. So send us a note and we will make sure we assist you. Okay, so before we get to the agenda, first of all, please feel free to unmute yourself or chat where you're coming from today and how hot it is it is where you are. I actually am in Sacramento and it's already about 95 degrees, kind of in a heat wave. So not to make myself jealous, but send a chat, put in a chat or whatever. Where are you from and how hot is it? So anyway, especially share if you're somewhere great. So while that's going on, so today we'll be discussing the fiscal year 2023-24 service data collection. And we'll also discuss some updates of how the service data will be reported by ADRCs to the ADRC Bureau this year. And finally, we'll go into some details about the required consumer service consumer experience survey for designated ADRCs, including methodology for gaining consumer feedback and how to report it to the ADRC Bureau. But first, to kick us off, please welcome Letty Zuno. She is the Executive Director of Access to Independence San Diego, which is part of the Imperial Emerging ADRC. And she's also the co-chair of the ADRC Advisory Committee Data and Outcomes Work Group. So Letty, thank you for joining. And you've been a part of this evolving ADRC data collection for a few years now. Thank you.
I have. Hi, everyone. Thanks, Amanda, for introducing me. Again, my name is Letty Zuno. I'm the Executive Director, Access to Independence. We do cover all of San Diego County, Imperial County next door to us, which, by the way, I should have put that in the chat, is about 118 degrees today. So we're looking at our folks over there, our constituency out there because of the excessive heat warning going on out there, as well as we have we serve Hawaii as well, and have been working on helping mitigate some of the issues with the fire in our neighbor island in Maui. So I've been working on donations and I'm getting some relief out there for our neighbors. Our office is in Oahu, so while not directly affected, we have a lot of partnerships out in Maui. So thank you for letting me say that right at the beginning. I have been a part of the Data and Outcome Work Group for a few years now. Prior to that, though, personally and professionally, data is just something that I really like wrapping my own head around. For some reason, just my brain is very data driven, and I actually get very excited about data, which I know for those of us, myself included, who do the day-to-day work, data is a bit of a nuisance, right? Because when we're out in the field trying to connect people to direct services, or we are providing direct services, our mind is kind of twofold, right? We have our professional but human empathetic side where we're trying to connect with people and work on the quality of the relationship, the building of trust that we want to have with people. And at the same time, we realize, well, I have to ask certain questions. I need certain information from people. I need to ask a lot of things because I have to, this data that I need to report on. what that looks like big picture wise, it's really important to work groups like us and the ADRC in general, because what we're trying to do, what we're trying to demonstrate is that this system works, that the model works, that the human aspect and the numbers aspect can tell a full, rich story. And then for those of us, or if not all of us, who understand maybe also the business side of what we do, the idea or the goal is that it leads to potential additional funding, which is what we're all always looking for and we're all striving for. And we know that data drives funding a lot of the times. The stories, the impact stories are helpful. They're wonderful. They're amazing. They speak to the humanity of what we are and what people are experiencing in the world, in our communities. But the data is important too. And maybe right now for me, I'm so worked up because my head has been everywhere right now with what's happening in Maui and the devastation of our neighbors there. But haven't been able to reach out immediately to the federal government to assist our constituents, which are people with disabilities, kids with disabilities who have been told they have to go enroll now at a totally different school districts. And so we're having to send people out in the field. We had to, believe it or not, immediately send the feds data to support us wanting to be able to use some of our dollars to provide relief efforts over there, which is staff time for us, by the way. We have to send staff out there and help people advocate and enroll and find school districts, and they're going to help all of those displaced. But it's just another example that in crisis as well, in emergency situations, the data that we have, the additional data that we're actually in the last year been able to compile is helping us with these efforts. And so not like I knew that was going to happen, but this situation is just another example of why data is so important. I'm going to get off my high horse in 2 more seconds. I do get very excited about data and also understand that it's a nuisance to gather it, to collect it, and to ask you to do more, to ask more questions. And here's another tool, and we're trying to fill gaps and all that. But we need it as well. In conclusion, thanks so much, everyone.
Betty, thank you. And also, if there's anything you wanted to put into chat about, with information about the Maui fires, please do, share with all of us about how we could all help, or anything that you're all needing in terms of assistance.
Thank you. I'll put our website in the chat. That's where we're helping with donations and very specifically what are what's really critical and needed right now. So that should be on our website. I'll put it on here.
Thank you very much.
Thank you.
Yeah, information would be really helpful. And that why is a great example of the data collection and its power and use quickly. And today, as we move into kind of the what and how of ADRC data, I think Letty just really expressed the why for us today, and why it's used. So your partnership data reports are intended to show how consumers are being served by the local no wrong door systems, and show how those needs are served by the community. We also do benchmark the data that's submitted and compare it year to year. So hopefully showing improvements in local ADRC systems and consumer service. And then every year, at least once, and then lately more frequently, we're asked by legislature or other organizations to report on ADRC or local no wrong door performance. So data does tell that story of how local no wrong door systems are serving consumers, and we're moving to continue to do more with this data, and moving into future consumer outcomes and performance. So we look forward to more engaged conversations like today about what that looks like. So thank you. So today we have some information to share about the updated ADRC service data report. But first I wanted to touch on some requirements for ADRCs in California For designated ADRCs, completion of program goals and objectives to expand and enhance ADRC services offered to consumers, submitting quarterly data reports, which are cumulative throughout the year. And then new this year is to submit data from a customer experience survey. Also, a clarifying note about the service data report itself. There have been some questions this past year about the data and what should be reported in it. So the report is not tied to a funding source, and some ADRCs may have assumed only to report consumers served by staff or access that was funded by the ADRC infrastructure grants. This is not the case. It's actually any service offered by an ADRC, no matter what the funding. So just wanted to kind of clarify that. And then moving to emerging ADRCs also work to develop their local service delivery models to eventually become designated, hopefully. And then they submit quarterly work plan updates. They also can participate in the consumer experience survey, which you'll learn about today, if you wish. So it's optional for emerging. And then for any ADRC receiving infrastructure grant funding, there are some program narrative, budget, expenditure, and closeout requirements. And if your ADRC is unclear about what reports are entailed, please email adrc@aging.ca.gov and finance@aging.ca.gov. And I'll also put those emails in the chat. So we're able to help send those funding related report templates over to you. So now that we've talked about the bigger picture of where we've gotten with the new data report, let's talk specifically about the enhancements made to the report. And please welcome Sandra De Silva, who is the Research Data Analyst 2 for the ADRC Bureau. She came on board in April and has been working diligently to improve the way ADRCs report data. Thank you. And Sandra, hello.
Hello, everybody. Good afternoon. My name is Sandra De Silva. So we have some updates on data collection. First, for the fiscal year 23-24 service data report, there isn't too much more that is new except for two areas. First, a data point that is important for service reporting to the legislature is being added back in. These two elements used to be collected in years past, but were not collected last year. So these two are the number of consumers served for options canceling is being requested for options canceling, and the number of consumers served for short-term service coordination is being requested also. Currently, the number asked for on the form is individuals identified as a candidate for options counseling and/or short-term service coordination, but not numbers served. The outreach activity section, count of activities and count of contacts, and application and eligibility assistance, count of contacts assisted, are no longer tied to each other. This gives ADRCs more flexibility to report all of the application and eligibility assistance without having to tie it to an outreach activity. Hopefully, this is good news for the ADRCs to report this data. The service data report instructions have also been updated to better clarify areas that ADRCs often ask questions on. Please read through the instructions carefully when you receive them. And finally, a data dictionary is being developed and will be delivered in this fiscal year. Next slide, please. So the service data report form is now in online form. MS Forms was chosen to create the form because MS Forms is accessible. MS Forms is user-friendly and intuitive to use. MS Forms is able to export data directly to Excel to use data analytics. The biggest difference, other than being online, is that core partners will not be required to supply a signature on the data report. One report submission per ADRC, please. So it's not each partner reporting data individually. It's one report submission per ADRC. After you have submitted your online service data report, You will be able to request a copy via the ADRC inbox. Also, some instructions for the data elements have been added to explain how to enter data into the text boxes labeled Other. We hope this new online service data report for fiscal year 23-24 will support ADRC data collection and reporting. Next slide, please. The first area of adjustment is in the instructions for the service data report. Just a note, take your time to read the instructions. You will be glad that you did. Additional guidance has been added for commonly asked questions by the ADRCs, and some data definitions have been added at the end of the instructions. Next slide, please. The new online form will be emailed as 4 separate links. There are 4 forms for each section of the service data report. The 4th form is only for the 6th and 12-month reports, which are Q2 and Q4. The form is accessible. Form colors meet contrast requirements for both text and background. There is a screen reader, and keyboard navigation is also available. Also, as long as the form is open, ADRCs have the flexibility to revisit the form at any time to edit answers. However, edits cannot be made once a form has been closed. Submitted data is final. If you need to resubmit, please contact us. And please email the ADRC inbox if you would like to request a copy of your report. Next slide, please. So after ADRCs submit the reports, what happens? The ADRC team will follow up with ADRCs to confirm the data that was submitted and gain a better understanding of the information submitted. The data team will follow up with any questions. After the Q2 and Q4 report, the ADRC team will schedule a report review meeting with the data reporter and anyone else your ADRC wishes to invite to the meeting. Each quarter, identified trends help give a view of the overall ADRC program. That data is also shared with ADRC partners and leadership to help inform the program in the future. As always, your feedback about the form and instructions is important to us for continuous improvement of our data collection efforts. Next slide, please. This concludes the review of the enhancements to the fiscal year 23-24 ADRC service data report form. Thank you for your feedback and participation in the submission of your data. The data your ADRCs collect and report demonstrates how ADRCs can impact the lives of individuals. We have some time for comments and questions. Please use the raise hand function or place your questions or comments in the chat.
Thanks, Sandra. I see a couple came through in chat while you were talking. And then for those I might have missed in the chat, let me know. But Roy, you wanted to know when the online form closes. Sandra, I think you've indicated on the form that there's reporting periods, so it wouldn't necessarily close. Is that correct?
The form will close like when you close the actual MS, when you close the form, like maybe you shut down your computer for the day or you just close the form. But if you leave the form open, throughout your workday, you can revisit it throughout the day. But once it's closed, you won't be able to finish that section of the form. And because the form is broken up in 4 sections, you should be able to finish and submit in one sitting. But if you don't have the time and you need to step away, you can do that as long as you don't close the form. But once you submit, you click submit, the data goes to us. And you can contact us through the ADRC inbox with any questions you have if you need to resubmit.
And also a good guide when the form is sent out to all ADRCs is we will have a kind of just a PDF version of it or a fillable, if you want to kind of have like a draft of your data, usually I think a lot of people do the draft and then they can submit the final data on the online form. So we'll be able to send that out, or an Excel sheet. Thank you. And let's see what else. You had questions about expanded version of the text cells within the report. Could you describe a little bit? And if we can't answer now, we can definitely come back to it.
No, Amanda, I'm here. I apologize if that wasn't clear. So the cells that we type into that don't require a numerical response don't expand. And so if your response exceeds the amount of space in that text box, you have to scroll up and down through the text box to actually be able to see the responses. And when we're talking about our I'm just trying to think of an example, but when we're thinking about outcome measures and the rest, where you have a whole bunch of measures that need to be inputted and discussed or detailed in some way, there's just not enough room in the text box without having to do the scrolling technique, which is, as I said in my chat message, it's really frustrating and time consuming to roll up and down through there looking for a response that if you could see it sort of in one area, it would be easier to be able to address.
And I think you're probably talking about the PDF form. That's the current form.
Right. So
yeah. Okay. So I think online that gets resolved, but
does it? Okay, great.
You can take a note of that, make sure there's no limitation and that the text box is big enough, I think, for.
Okay, I will, I'll keep that in mind and try to make sure that when you're filling out your text response that you're able to see most of your response.
Yeah, and as long as I'm on mic right now, I had a second question I was typing into the chat. So just to clarify your response about the submission. So it all has to be, all of the responses have to be completed in a single sitting, because even if we were to close it but not submit it, those responses are lost. Is that right, Sandra?
Well, yeah. So like, for example, you open it up first thing in the morning and you start filling it out, and then you're like, oh no, I have to go to lunch. You know, time passed. You still haven't finished, but you can leave it open. And, you know, after lunch, you come back, it'll still be there and, you know, it won't shut down. And you can fill it out. But if at the end of the day, you haven't clicked submit and you shut down your computer, all your answers, you know, you won't be able to get those. So be sure to click submit once you have answered all of your questions. But it should be okay because the form is broken out into 4 sections. So you complete each section at a time.
So right now the sections are broken up roughly, like demographic data is one, service data is another, et cetera. So hopefully, as you know, I think the main thing is typically what we've heard, at least, is the PDF form that has been submitted is like, there's always the sketched rough draft somewhere, and then people transfer it over into a PDF. So hopefully the sketch draft is still happening, but it's just moving into an online form. And then that can be exported into Excel for anyone who
okay.
Move their data
kind
around.
of use the same technique, but it's a different, it's a different tool.
Yeah. And no signatures, which is great.
That's a great response. Thank you.
Yeah. I also see in chat, so there's a couple of hands raised, but a couple on chat are asking about when it'll be delivered. We wanted to have this data workshop first and send the new forms in the next week or so within updated instructions. So the form will be ready in time for October 31st submission deadline. So you'll have time to look at it and review it. So, and I think, Ben, your hand was up first, and then Lizette.
Hey everyone, thanks for your work on this. I use forms a lot, so I totally understand why you want to be doing that. Just a couple of maybe comments from some things I've learned the hard way, or whatever they may be worth. First is there is a 4,000 character limit per question in Microsoft Forms. So don't be that eloquent. That's a page or two, depending on how many letters you use in a word. If there is a built-in limit, and Microsoft does not let you avoid that, so long text responses may not be the best. However, If you're writing that long of a response, maybe there are other things that you want to be thinking about. The second is, so every time you create a form, it saves on the back end an Excel structured set of columns, one header per question. If there's a need for editing, and I know that Amanda's been great about sharing PDFs and Excel versions, can I suggest that maybe after we do this first batch, so that you've created that sender, somebody's created a response that will automatically generate in Excel that has all the formatted columns. If somebody has a need to edit or change, maybe you can share that as a blank template. So then if we need to make a change, we can put it into a format that you don't have to go hunting for the answers. You can just move into the form.
Absolutely. That, yeah, we kind of assumed that would be the case. You know, if there was an update to any quarter in particular, we'd send out the Excel and that one cell could be changed and sent back to us.
Anybody who is going along thinking, what does all this mean? This is actually an improvement. This is better than the PDF. So once you do it the first time, you'll think, oh, this is a lot more straightforward. It's just a different process. So you want to do that work elsewhere and then copy and paste your answers in. That's really quick.
Yeah, thank you. I appreciate that.
Lizette, do you have any question? A question? I saw your hand was raised too.
Yeah, so just to clarify, the information that you're requesting isn't necessarily changing then. It's the same information that was on the PDF version?
Correct. Yes. With the exception, right? I was going to say
two additional data collection points. So,
right.
Yeah, so count of consumers served for options counseling is what we're adding in to this new form, and count of consumers served for short-term service coordination.
Okay, and then with that, like on the PDF, because right now the way that we collect the information is I'll usually send it to our extended partner and then our other core partner, and of course everybody kind of fills in their own because it's divided that way in those three sections. Is that still the case, or is it more of like just a total for the ADRC as a whole?
It's going to be the ADRC as a whole. We want each ADRC to submit one report.
Okay, so yeah, because we usually submit one report, but on that report, it's like divided into those three columns.
It's sounding to like maybe a template, something like your rough draft type template form might be helpful too. Lizette's right, like for ADRCs to use, like fill this out first, partners, and then we'll put it into the online form. Something like that. We can look into that. Our current PDF would work for almost everything except for two sections. So we can maybe adjust that.
Okay. And then yeah, because that's what I was thinking is to just use that still as our tool to gather all of our information together. And then of course, one of us would then calculate everything to put one number in for those quantitative things. But then that would, again, we'd have to go back and make sure that we're all identifying everything under the same definitions. And you're saying that the new instructions with some more definitions would be out within the next couple of weeks.
Yes, it's going to be coming.
Awesome. Thank you.
Thank you.
Thanks, Roy. I see your hand up as well.
Hi, my question is that currently on the PDF form, you get the approvals of the executives. Will that still be in play, or is that no longer needed?
No longer
needed.
Okay.
You may, as an ADRC, determine you still want something for that, which is absolutely fine. It's just that CDA is no longer going to require it on this particular document.
Okay, thank you.
Hi, Young.
Hi. So before Roy, I'm not sure who asked the question, but I just wanted a clarification. So the PDF, we had 2 or 3 columns where we have AAA and we have our core partners providing their own numbers. And depending on certain questions, core partner may not capture that information in it versus so AAA. But now what you're saying is we're combining our numbers and then reporting one consolidated number?
Good question.
No.
So we still have 3 columns or 2.
Yeah, you're still gonna have like it's not columns, but it's going to be, the questions are separated out and you're still going to have to report, you know, like core partner and executive partner. Yeah, those are still separated. Yeah.
Oh, got it. Okay. So I just wanted to confirm that it's the same. Okay, thank you.
You're welcome.
Thank you. Thanks for all these questions. And this has really been a helpful workshop already to identify things that we might want to put into our email when we send everything out. So thank you. Okay, unless there's anything else, and we'll continue to look at chat while we're doing the next section. But I just wanted to say, first of all, thank you, Sandra, for all the work you've been putting into this. It's going to be really fun to introduce this to everyone. And now I'd like to introduce Hetty Lim, who will discuss the implementation of the ADRC Consumer Experience Survey. It's a project that's been going through a few years of phases of beta testing, and so we're excited to introduce it today. And Hetty, are you there? There you go.
Amanda, before we move on, can I ask a quick question?
Sure.
Somehow I understood by email that the electronic submittal was optional, but it sounds like we're all moving to this process this quarter, right?
Yes.
We want to submit electronically. Okay, I just wanted to confirm that before
Thank you. Yes, thanks for confirming. And if it isn't accessible for any ADRC, we can find other ways to have your data submitted. It could be a phone call with Sandra to input the data for you, something like that. So if for any reason Microsoft Forms is not accessible, please do reach out to us.
Thank you.
Thanks for clarifying. Okay, so Hetty, here we are.
Thanks. Hi, everyone. My name is Hetty Lim, and I work with the ADRC Bureau team. One more slide, Amanda. We've worked on this project, as Amanda said, for a few years now, and with a lot of your participation, testing and creating the final project and beta testing last year. So we're excited to have it ready to go at this time. We'll look at the how and why of developing the survey and then next steps and what to expect. Next slide. So this survey data will help us to collect the strengths of the ADR system as a whole, as well as to also understand areas to improve. We're looking for ways to understand directly from consumers what we're doing really well and how we can improve our services across the No Wrong Door system for all Californians. Gathering information directly from consumers will allow us to reflect on how we are serving consumers as well as how we can serve them better. Next slide. So this survey, as we've said, has been in the works for a few years now, and you're likely all aware of how much work has gone into developing the questions based on your feedback. So beginning in 2020, we've been developing drafts that have been submitted to ADRCs for comments, alpha pilot testing with 3 ADRCs, and last fall, we were able to beta test with all of the designated ADRCs and made the process available to emerging ADRCs as well. We're providing templates. Oh, sorry, that's the wrong. Next slide. So during this whole process, we've refined the questions that are developed with specific feedback from both ADRCs and consumers through the alpha and beta testing process. It's a brief, simple survey with 9 questions written in plain language and focused on the consumer. It's intended to be completed in just a few minutes. As far as recommendations for sampling technique, we're requiring a minimum of 50 respondents per ADRC, but especially with larger ADRCs, you may end up wanting to collect more. We'll be providing templates for both paper printing for the surveys, as well as to read and to use as a phone script, as well as the translations in all 15 languages. Next slide. So some best practices for using the templates to gather the best information. We would recommend collecting data from consumers whose cases were opened at least 30 days prior and who have had at least 1 follow-up. So these may be closed cases or open cases, remembering that some consumers are continuously receiving services. Some other general tips and best practices: explain why we're asking for their feedback, that it will provide information to understand and improve our ADRC system, and the no wrong doors system. The form data should remain confidential and anonymous, and the ADRC Bureau is only viewing the aggregate data. If consumers wish to be contacted about their experience or their feedback, the last question in the survey allows them to provide a phone number, but this should be treated with confidentiality as well. ADRCs will be receiving a package in the next week, as Amanda said, that includes the Word document. It's a template that should be customized for printing. And the survey has also been translated into 15 languages along with the English. If the survey is being given in person or on the phone, to maintain that person-centered approach for the survey. Additionally, in the survey package, there'll be a spreadsheet for collecting the data in aggregate. It's very, very similar to the one that was used last year. If you need a more accessible format for this reporting, please let us know. The survey period will be just shy of 1 year, as we'll collect data through June of 2024. And we'll have 1 month after that to collect, after you finish collecting data, to get the data submitted in aggregate. Remember that while we want to see the comments, we won't want to see the contact information or any confidential identifiers. Thanks for your attention and for participating in this project. We'll take one more pause for questions. It looks like we already have one. So go ahead and raise your hand in the Zoom toolbar or post your questions in the chat.
Thanks, Hetty. And Lana, see your hand is up.
Sorry, I was having trouble unmuting. Yeah, the survey thing is, that's a little bit of a problem. And I feel over and over again, I cannot believe that I'm the only person, especially at an IL, that has this issue. You know, we are asked continually by funders to do surveys, especially in San Francisco, but I suspect in other places too. We deal with a lot of consumers who are undocumented, a lot of people who have mental health issues that they're dealing with, and they have trust issues. A lot of times we are the last coming to an IL. They've been to every other service agency in the city and they have real trust issues, or they've been kind of jerked around by the system. And filling out surveys is not something they want to do, even though we assure them that we are not collecting their personal data. They can be completely anonymous, that no one is going to call INS or whatever on them. And I respect that. Like, for me, it's always more important that our consumers get the services that they need than we get a survey back or a photo back or whatever it is that a funder is asking for. So while 50 may not sound like a lot for, when you say 50 a year, you mean for the entire ADRC, not just for my AAA and all the partners. It may not be that much for the city to come up with, but it may, you know. So I would love to see that survey first, because, you know, our consumers are quite guarded about their information, even if it's information just responding back about the services that they've received from us. You know, we had this problem when we tried to get people to complete the census. We had a lot of people who were just like, I'm not, you know, a census means a registry, or a census means that immigration is going to come after me or whatever. So like, I think those are very real concerns, especially in California, that need to be taken into consideration. Like 50 may sound like a small amount. It's actually no small thing to get 50 people to comply with that.
Thank you, Lana. We actually, with our beta test, had, I think the range was 50 to 100, and ADRC feedback was 50 was manageable no matter what size, and larger was a little bit harder, just for the reasons I think you're specifying there. So getting that 50, you know, it does take some time. And I don't know if any other ADRCs have feedback on what it was like for the beta test, how they maybe got around some of those trust issues, but we obviously want to be person-centered, right? So anything that we do, if they're saying no to the survey, we will not be forcing them to take it. So thank you for that feedback. Anything else coming up? Any other questions? As Hetty mentioned, the package of survey questions and translations will be submitted out soon. And it also, the questions are basically the same with some optional questions in there as last beta test, but the feedback after ADRCs performed the beta test last year was to make them into even more plain language and provide a phone script. So we have done that now. So looking forward to your feedback this time around to see how it's gone. Ben, I see your hand up.
So thanks for the updates and all the work on the city. And it's been a long running project. One of the things we experienced, sorry, I'm here for Venture ADRC. Alexia was never to join. We put together along not dissimilar lines from what Sandra was sharing, a simple Microsoft form. And what we would do is we could do that by phone. We could have a link for any of our consumers who completed interaction with us electronically, which we have some folks. Or if anybody needs it, you can actually just print out a Microsoft form, and it is on a paper. There's a piece of paper, so you can send that out to somebody, and then we have staff input that. And it's a burden for time entry, but if somebody really prefers doing it by paper, that's fine. And to Lana's point, we just said, look, this is an optional survey. This is a chance to shape the future of the system in California. If you're willing to take a few minutes to provide us some feedback, great. If not, no pressure. And so we made that as an optional piece. And if anybody's not interested, no problem. End it, and there's no pressure. But I hear what you're saying, Lana, about some folks are just not comfortable with that level of information. So we made it optional, made our numbers for lower. And there is some obviously bias because you have people who are willing to put their name or personal information on that feedback. So it's not truly random sample, but that's okay. So like at least we have some information on whether or not the services we think helpful. So our perspective forever is worth.
Thank you, Ben. And if there are any ADRCs that are interested in seeing the form you build, are you able to kind of, can you be contacted with what, provide them for questions?
You can email me. I can share the form with you. We have a government license, so I can't just link it to you, but I can copy and paste it and you're welcome. It's really easy to build to get up. So.
Thank you. Anything else? Travis, hello.
Hi, Amanda. I just had a question. It mentioned random sampling for the way of gathering the surveys. The means that we've actually been using since we first did the kind of pilot of the consumer survey is we have just been incorporating it as part of our follow-up process. Mm-hmm. So if we, any client that we're doing a follow-up on that we're able to make contact with, we would go through the consumer experience survey with them if they're open to doing that. Is that something that would still be appropriate under this,
Definitely.
Yeah. Okay.
Yes, absolutely. Thanks for the question.
Yeah, thank you.
Great to share an example actually of what that looks like for ADRCs.
Sure.
Very good. Anything else that's coming up for folks? And just as follow-up for our discussions today, so you'll be receiving basically 2 emails from ADRC's mailbox in the next couple of weeks. The first will be the Consumer Experience Survey Package. There is a zipped file with all of the word translations. So I know Hetty was kind of working on making sure maybe you would respond to the email when you receive it so we know you got it, because I think some organizations strip out zip files. So if your organization does that and you already know, send us an email so we will get those files to you differently. And I think, is there anything else, Sandra, is there anything else that you can think of before we wrap up?
No, I just wanted to thank everyone for their participation and their feedback on the form. And please email the ADRC inbox with any questions or comments that you have from today, and we will get back to you.
Thanks, everyone. And if you have any additional questions, we'll probably be staying here for a few more minutes. So if you want to stick around, that's great too. Thank you. Have a good day. Stay cool for those who had 118-degree heat. So we'll see you soon. Thanks.
Thank you.
Sarah.
Yeah, hey, I just had one question. I think you might have answered it and I might have not caught it. Are we gonna have access to the reporting form through the CDA website still? Like we had for the form before, like, you know, how you can download it from the CDA website. Will we still have that?
Yeah, so we will put the whole package of everything up there. Absolutely. Okay. Yeah, we're just finalizing, making sure everything, we wanted feedback today to make sure everything was covered before we finalize it out. So,
okay. Thank you. Just wanted to make sure.
Thanks, Sarah.